Wapenhaun da. It is now just over 10 days since the firebreak period here in Wales came to an end. And this afternoon I wanted to share with you the latest information we have about the impact of that firebreak on infection rates in Wales. This morning the Chief Medical Officer for Wales has published his conclusion that there is good evidence that the Welsh firebreak has had its intended impact on the transmission of COVID-19. And you can see from this slide just how far and how quickly cases of coronavirus have fallen in that period at the right-hand end of the slide. We've seen a consistent reduction in the rate of coronavirus across Wales in the last 10 days. We've seen a consistent fall in the positivity rate, that's to say the percentage of tests which turn out to be positive. The 7-day case incidence rate for Wales has fallen to around 160 cases for every 100,000 people in the population. And that ranges from just over 20 cases per 100,000 in Ynys Môn to more than 350 cases per 100,000 people in Blaen y Gwent, and Blaen y Gwent is now the highest area in Wales. We've seen a huge drop in the case rates in Merthyr Tydfil from a high of around 770 cases to now around 250 per 100,000. But of course, we need to see that figure improve further. And that's why we will start our first mass testing programme in Merthyr Tydfil this weekend. We will offer testing to everyone living and working in the local authority area over the coming months, and I hope, of course, that as many as possible of Merthyr citizens will come forward to take part in this very first mass testing programme in Wales. We've also seen, as a result of those figures, a fall in the R number. The latest estimate for R, and that was a week ago, was between 0.9 and 1.2. And the latest ONS infection survey has just been published at the end of this morning. The results suggest that the number of people with coronavirus last week in Wales has fallen by about 40% compared to when the firebreak period was instituted. Now, as we would have expected, we're yet to see this translate into a sustained reduction in pressure on the National Health Service. The wave of cases going into the NHS is always going to be about 2 weeks behind what we see in the community. But we have seen the rate at which people are being admitted to hospital in Wales with coronavirus stabilise over this last week. Nevertheless, there are still currently the equivalent of more than 50 hospital wards full of people seriously ill with coronavirus. And many of those people may end up being in hospital for up to 3 weeks. And very sadly, we continue to see high levels of deaths involving coronavirus here in Wales. The Office for National Statistics has said that there have been more than 3,100 coronavirus-related deaths this year. And those deaths are now back to their highest level since mid-May. In every one of these briefings, I want to take a moment to acknowledge the experience of families of all those people and those people who have died during this second wave of coronavirus. It's right that our thoughts are with those families and with those communities. I want now to turn to what is happening in Wales today and what is likely to happen in the weeks ahead. We have always said that the real and lasting impact of the firebreak would depend on how we all act once that period was over. And here, I'm afraid, the news is more mixed. Most people in Wales go on sticking with it, doing whatever they can to help turn back this deadly virus. But this is not universally the case. I receive letters and emails every day from people all over Wales, worried about how others are socialising in large numbers or gathering in their homes. Our police forces have reported in the post-fire break period that they have had to respond to more than 1,000 coronavirus-related incidents, where the behaviour of a selfish minority is putting everybody else at risk. Now, many of you will have seen just this morning that as Northern Ireland is coming out of a long period of lockdown, the Northern Irish Executive has announced plans for a new 2-week circuit breaker, a new lockdown, which will start on Friday of next week. And new strict restrictions are being introduced in large parts of Scotland, including Glasgow, to control rising cases of coronavirus there. Now, this is exactly what we are trying to avoid here in Wales. It's against that background that the Cabinet this week reviewed the national measures we have put in place in the post-fire break period, and we have decided not to change them. There is no room for a further relaxation of those measures, and they will remain the same for the next 2 weeks. And we need everyone, every single one of us, to play our part to make sure that we continue to build on the progress of the firebreak and to keep those coronavirus cases falling. And it's simple. We know what we have to do. We have to reduce our contact with other people as much as we can. We have to avoid travelling unless it is really necessary. And we need to work from home wherever we can. If we do all this together, then we can have a path through to Christmas. And I know, of course, that many people will be planning for Christmas and will be hoping to see family and friends over that festive period. We are working closely with the Scottish, the Northern Irish and the UK governments to develop a common 4-nation plan to help bring people together safely over the holiday period. There's been a great deal of speculation about what a plan may look like, but it's still being worked on. And here in Wales, we continue to respond to this global crisis by planning first and announcing those plans next. And that has to be the case for Christmas arrangements as well. Now, this year has been a very difficult one for all of us. We have all had to cancel or postpone plans as our lives have been affected and put on hold by the pandemic. No one enjoys the stop-start nature of this year, and we're all looking forward to when our lives can move beyond coronavirus. But as I've said many times, government alone cannot stop this virus from spreading. The power to prevent people catching the virus lies in the hands of each one of us and the choices each one of us make every day. We know that coronavirus is a highly infectious disease. It thrives on human contact. That's the reason why we ask everyone to keep their contact with other people to a minimum and to think carefully about where we are going and what we are doing. If we go on doing this together, we can keep ourselves, our families, and we can keep Wales safe. Diolch yn fawr iawn wrth cwrs I chi gyd. I will take questions now, as usual, and as ever, all the answers will be broadcast live on our own social media channels. First of all, today, over to James Williams at BBC Wales.
Diolch yn fawr, Prif Weinidog. Can I get this answer in Welsh and English, please? We're currently, as you say, seeing the benefits of the short lockdown period, and the numbers are still dropping, and because of the lag, we expect to see that continue perhaps over the next week or two. But as you say, a minority doesn't seem to be complying with the current restrictions. So I'm just curious about the timing of this. There's a chance, isn't there, that from the start of December, we start to see those numbers rising again in the lead up to Christmas. And so therefore, isn't it inevitable that you're going to have to do something before Christmas to really, if it's just a tighter restrictions or another lockdown, to deal with it and give you that space for Christmas?
Well, I wouldn't agree, James, with the word inevitable. It isn't bound to be the case, but it can't be ruled out that it would be the case either. But it's in our own hands. Nobody is making this happen other than the things that we ourselves do. And if we do the things that we have been talking about ever since the lockdown period, then we can still have a pathway through to Christmas. If people react to the end of the fire break as though coronavirus was over and that there's nothing more we need to do, then it's very likely indeed that we will see coronavirus come flooding back into our communities, and then we will be faced with another series of difficult decisions. But that's why my message today to people is that doesn't have to happen, and the way to avoid it happening is by doing the simple things that we've talked about so often: avoiding human contact where you can, only travelling when you need to, working from home when you can. All of those things will make a genuine difference. And if we do that, we can still build on what we've achieved together in the fire break period. If we don't do that, then coronavirus will be on the rise again, and we'll be back into the position that we faced in the middle of October. So just i ddweud, does dim rhaid I ni fod nôl yn y sefyllfa oedden nhw'n wynebu nôl yn mis Hydref. Mae'n yn y dwylo ni I gyd. Os ni'n neud y pethau syml, allwn ni cario ymlaen I wneud pethau dy gilydd ac I adeiladu ar y llwyddiant ni wedi gael yn y cyfnod clo dan yn y toriad tân. Os dydyn ni ddim yn wneud hynny, wel, mae yn golygu ni'n mynd I fynd nôl at y sefyllfa oeddwn ni'n wynebu yn mis Hydref. Os ni'n neud pethau dy gilydd, neud y pethau syml, mae llwybr da ni, dal da ni, tan y Nadolig.
Diolch. And I note in this morning's interviews, you talked about if you can reach agreement with the UK governments about common plans for Christmas. Why is that? Is it partly because all four countries are in very different places? We're going to have another lockdown in Northern Ireland, tighter restrictions in Scotland, there's a lockdown in England until the start of December. Is that the problem, that we're on different trajectories and therefore we're going to be in different places for Christmas? And you talked about there being a priority for getting a rule on travel, but do you not expect anything beyond that?
I do hope it will be beyond travel. James, there's a series of things I'd like us to agree on, and I think we do all come to the table looking to agree things. But as you say, we're in different positions in different parts of the country in relation to the disease itself. And there are different traditions in different parts of the country as well. In Scotland, for example, the New Year celebrations have always been a more significant part of their national way of marking the winter festival than in some other parts of the country. So there are different things that have to be thought about in the different contexts that each nation faces. We did agree a series of principles last week that go beyond travel, but now that has to be turned into the detail of a common plan. That's what we've asked our officials to work on together, and there will be a further meeting once that work is complete. We've asked for our chief medical officers also to review the work that is being done to make sure that it has been properly interrogated from a public health perspective, and I will go to the meeting whenever that happens, once again looking to create as much common ground as we are able to between us. James, diolch yn fawr. Adrian Masters next of ITV Wales.
Thank you, First Minister. Can I then therefore clarify that last point? Is it for the sticking point, if you like, is where the area of disagreement about the amount of mixing, the number of households that you would consider allowing to mix over Christmas? And related to that, if the advice from your Chief Medical Officer is different to that agreed with the rest of the UK, would you go against it?
Adrian, just to be clear, there are no sticking points and there are no disagreements. There is a discussion going on in which we share the perspectives of the four nations and the circumstances that we face. Now, in Wales, 2 households can already meet. That isn't possible anywhere in England, and it isn't possible now in large parts of Scotland, and won't be possible in Northern Ireland either. So we start from different places. That's why it's important that we share as much information as possible and work on the detail together. But it's not on the basis that we are disagreeing with one another. It's on the basis that we need to make sure we've understood some of the complexities that will be there. Here in Wales, we have always put the public health part of this emergency as the central lens through which we view what we will do. And the advice of the Chief Medical Officer in Wales will always be, very significant to us in decisions that we need to make. But it's why we have asked all 4 Chief Medical Officers to look together at the detailed work that is being done and to give us a view in which, as I hope, they will also come together to give us a single strand of advice.
Thank you. The Chancellor is reportedly looking at freezing public sector pay in the areas the UK government is responsible for in order to pay some of the costs of the pandemic. Are you considering looking at any kind of public sector pay freeze in the sections that you're responsible for, NHS, education, fire rescue, local authorities?
Well, I've seen the same reports, and I really hope that they are not true. The notion that the costs of dealing with this pandemic should be heaped onto the shoulders of frontline public servants seems to me to be exactly the wrong answer to the experience we've gone through together. And it doesn't make sense to me in sheer economics to extract purchasing power from the economy at a time when you want the economy to recover. Those are people who go out and spend that money in shops, on goods, on services produced in the private sector, and a freeze on wages means there'll be less of that money going around. And, just at the point when the IMF is saying to us we need another fiscal stimulus to allow the UK economy to recover, the Chancellor appears to be embarking on a course of action in exactly the opposite direction. The problem from our point of view, Adrian, as you know, is that if there is a pay freeze on teachers in England, that feeds through as no money at all in the Barnett formula for us to provide an uplift for pay for teachers in Wales. We will face some very difficult dilemmas, but they will be dilemmas of the UK government's making. And at the moment, my efforts are focused on saying to the Chancellor, please don't go down that path. It's neither fair to the people involved, nor does it make sense economically. Diolch. Adrian, draw I Adam Hale at PA.
You mentioned measures in place or imminent elsewhere across the UK at a time, of course, when Wales people in Wales can go to pubs, travel across regions, go help for leather and Primark. Perhaps you pointed to being able to go into lockdown and come out earlier, the good thing. But as things stand, as we approach Christmas, Wales could end up in worse nick than anywhere else in the UK, couldn't it, based on the fact that virus case rates go back after strict measures cause them to drop. Have you put Wales at greater risk of stricter measures at Christmas or just after than the rest of the UK because the brakes were applied so early?
Well, the brakes were applied early, Adam, because that was the advice of SAGE, wasn't it? Their advice to us all was that the earlier that we could introduce a fire break, the more effective it would be. And if you delayed, you would just end up having to have a longer fire break to achieve the same effect. So I don't think that it would be a fair reflection to say that by going early we have created risk. what we have done is to act early in line with the scientific advice to reduce the risk. Now, I just go back to what I said in my opening statement, that we have created a platform through what we did during the fire break period, and a successful platform. We can either build on it or we can fritter it away. And if we fritter it away, then we will be facing difficult days in December. But that is not inevitable, and it is avoidable. But the way it is avoidable is by each one of us thinking about the way we behave in our own lives and circumstances and making a contribution to keeping the virus under control.
Thank you. You touched on this briefly, but this morning you mentioned you were more hopeful about the issues of travel this Christmas period than you are on other aspects of discussions between the UK nations. Can you spell out the aspects you're hopeful about?
Well, I'm more hopeful on travel. I'm generally hopeful that we will reach an agreement on a range of issues, but travel is the one I think which is most important to us in Wales because of the permeable nature of our border. But the other things that will need to be thought about are how long any period of relaxation might last, the extent to which a greater degree of household mixing might be possible during any period of relaxation, how we factor in things like movement of people from one part of the country to another, and, as I say, how we plan together for the fact that in any relaxation, when people mix and get together, coronavirus will spread. That's what this disease loves. And if for the special reasons of Christmas, we are to allow more of that to happen, there will be a period afterwards where we see those figures rise again. And I am keen that across the UK, we think about that together and think about what measures we may need to take in response. Adam, diolch yn fawr. Over to Dan Bevan at LBC.
Thank you, First Minister. Good afternoon. Do you think that it's right that after household mixing around Christmas time, that there are promoted events like Boxing Day and New Year's Day sales, in which people will be encouraged to come in high numbers into stores which, although there will be measures, I'm sure, will inevitably spread the virus?
Well, personally, I don't think that that is a sensible strategy. I agree with you, Dan, that, most retailers are very responsible and have done a great deal to make sure that the risk of coronavirus is mitigated. But it isn't just the risk when you're in a shop. It's everything that goes with people travelling, people mingling outside. All of those things add to risks. And there is nothing time critical about sales in a post-Christmas period. We have worked very hard with the retail sector and others to try to find a pathway through to Christmas where those shops can stay open, because I understand that, if you're selling goods for Christmas, you need to sell them before the 25th of December. But beyond Christmas, there seems to be much less of a case for the need to try and encourage people to come together in large numbers and run the risks that will inevitably be there. So I'm hoping our retail sector will go on doing all the things that they have done very carefully already, but also think carefully about whether or not patterns of sale beyond Christmas can be smoothed out, done over a longer period, rather than encouraging people to all rush to the shops together.
Thank you very much, First Minister. And of course, this morning we heard very sad news of 15 deaths in the last 3 weeks at a care home in Llangollen. Simply, after all this time during this pandemic, how can this still be happening? And of course, with mass testing now being deployed into Merthyr, surely it would be better suited in enclosed settings like residential care homes to protect the most vulnerable.
Well, on the first part of your question, I do think that the rules around care homes are much stronger now than they were back in the spring. That we've got a much better understanding of the way the coronavirus spreads. But once coronavirus is in a care home, it is there with a group of the most vulnerable people with underlying health conditions, elderly people, and it's a virus that just attacks people in that deadly way. And once it's in a care home, then it really is down to all the things that the care home itself has to do in terms of infection control, in terms of the way that staff use PPE and so on. A lot of help is being provided, both to that care home in Llangollen, where there is that very sad story today, but other care homes as well, to make sure that all those basic things that the care home itself has to take responsibility for are being done in the best possible way. But hard as people work, coronavirus remains a deadly disease, and in a vulnerable setting, a closed setting, then it's at its most severe. We will look at ways in which the new generation of lateral flow tests, these fast turnaround tests, can best be deployed in Wales. We agreed last week at the meeting I referred to that the tests will be shared across the United Kingdom on a population share basis, which means that shortly we will be getting thousands of these tests a day. We need to plan now for how best to use those tests, both thinking about the settings where they will be most effective, but also the sheer practicalities, how the tests arrive in Wales, how they get distributed to where they are needed, how people can be trained to use them effectively, how the results of tests can be fed back into the health records of people in the NHS. These are significant challenges which are being worked on very hard at the moment, and care home staff and residents in care homes, you can be sure they are very much part of that conversation. Dan, thank you. Over to Abby Whittick at Wales Online.
Good afternoon, First Minister. Scotland has committed to giving 1 million vaccinations between now and January, and saying that everybody over the age of 18 will have a vaccination by the spring. Can you make any similar commitments in Wales?
Not in a position to make a commitment of that sort. I have yet to see the actual figures of the number of vaccinations that will come to Wales this side of Christmas. I'm going to stick to the way we've done things throughout the pandemic in Wales, which is to have a plan and to work on the plan and to then make an announcement, rather than to opt for eye-catching headlines, which you then have to scramble to find a way to deliver. As soon as we know the number of vaccines we have, we will let people know how those vaccines are going to be delivered, who they will be delivered to first, and how we will build on them thereafter. But I'd rather have a plan that people can rely on rather than a headline that looks good for a day.
Thank you. There are widespread reports from SAGE that for every day that restrictions are relaxed over Christmas, that will lead to 5 days of lockdown. You've obviously seen those reports. What do you think that's a fair trade-off and a safe way for us to approach Christmas?
Well, I do. I think I've said a couple of times this morning that if we relax the rules over Christmas and people meet each other more, coronavirus will be spreading more than it otherwise would have been, and we need a plan to deal with that. Now, I've seen reports of the SAGE formula, but there are other things that have to be taken into account. I'm interested in what people think about this themselves. I've been following a number of the sort of conversations you see people entering into as to whether or not Christmas is so special for people that they would think that that was a reasonable payback for it. And as ever in Wales, we would like to be in a conversation with Welsh people about where their priorities would be. At the moment, I think the message is from people in Wales that they would like more of an opportunity to meet with family and friends. But Abby, your question is the right one, that I have to say to people, if that's what we do, then we will have to act afterwards in a way that deals with the consequences. Thank you very much. Over to Howard Griffith at BBC Network.
Prynhawn, we see since the fire break numbers coming down over the last 10 days and shoppers going out, people mixing far more. what are your concerns about potential complacency? What are you planning if that graph goes back up again?
Well, I am anxious. However, as I said in my opening statements, of reports of people behaving post the firebreak as though coronavirus had now disappeared. I've always been a bit anxious about some of the UK press reporting of vaccination, as though, you know, we've got a vaccine, it's all over, you can do as you like, because that absolutely is not the case. That's why I go on and on, as I have again today, in saying to people, coronavirus is still here, coronavirus is still killing people, coronavirus remains a deadly disease, and the way we act in our individual lives is the difference between us being in control of it or it being in control of us. Now, because our firebreak did succeed to the extent that it has, we have a pathway through to Christmas without needing to impose further lockdown periods. But it's not inevitable that that will stay the case. And my message has to be to people, it's in your hands, it's in my hands, it's in every one of our hands together. The decisions we make about how we behave in our individual lives will either put us in a position to build on that firebreak success, or will simply put us back to where we were in the middle of October. And if we are back in where we were in the middle of October, then our NHS will once again be in real difficulties. And what I don't want to see is our NHS simply having to deal with coronavirus cases and other things which are so important being squeezed out of the ability of the NHS to be able to respond.
Diolch. As Wales came out of firebreak, we came under national restrictions from Ynys Môn to Blaen and Gwent. The rates are massively different, but we have the same rules. Why have we abandoned local lockdowns when other parts of the UK have decided that's their route out of lockdown?
Well, other parts of the United Kingdom are in lockdowns of their own and for longer than we felt we needed to have one here in Wales. Look, we have been drawing more on the advice of behavioural scientists alongside others in recent weeks. And the advice we had was very straightforward, really, that the more complex rules are, the harder people, even people who really want to follow the rules, the harder it is for them to know what the rules are and the more difficult it is to follow them. And that a simpler set of common rules had a better chance of people being able to understand them and then do the right thing by them. And that the different local restrictions that had grown up over the autumn were causing people to feel that they didn't know what was being asked of them, and therefore that they didn't always do what was necessary. So that was the calculation. There's always a trade-off here. It's a trade-off between simplicity, clarity, and therefore the ability of people to follow the rules, as against more precise, more targeted, but inevitably more complex and difficult to follow restrictions. Hywel, diolch yn fawr. Over to Steve Bagnall at the Daily Post.
Thank you, First Minister. Returning to the question of Christmas, it's appreciated people want to enjoy the festive period, but if there is any relaxation of restrictions in Wales, even as has been suggested in England, compensated by a number of days after in lockdown for a day of relaxed conditions over Christmas, this will put people at increased risk. I mean, is that a price worth paying?
Well, it doesn't put people at increased risk, Steve, does it? Because people can still choose for themselves how they use those new freedoms. And even if we are able to offer people new freedoms, I still hope that people in Wales will think very carefully about doing the right thing. You know, it would not seem to me sensible, even if there are more freedoms, to be mixing with vulnerable elderly people who, if they were to catch the virus, it could be very serious indeed for them. So it's a matter of allowing more possibilities for people, while still being very clear with people that you should think very carefully indeed about how you exercise any of those freedoms in your own lives, and not doing things that pretty obviously put the most vulnerable people at risk.
Thank you, First Minister. Different topic. We were contacted by someone in the holiday cottage home industry this week who said the sector is seeking answers about when they can start taking bookings from guests in England to boost business. Now, obviously, England is in its 4-week lockdown. There are travel restrictions. But is this something that could be explored after, or do you think it'll be months before this will be allowed to happen?
Well, I met with representatives of the hospitality and tourism industry earlier this week in what was a very constructive meeting. This issue was raised with me there. What I've asked the sector to do is to work with us on a set of rules that might allow that to happen safely. So at the moment, I think we wouldn't be confident that if people were to travel to holiday lets in Wales, that they would be arriving in the extended household to which they are confined. But the sector, I think, was very keen to think imaginatively and creatively with us, and I've given them a guarantee that at the next 2-week review, we will hear anything that they are able to offer us, and we will consciously make a decision as to whether or not it's possible to make different arrangements. It will depend on those arrangements being watertight from a public health perspective. Steve, thank you very much. Draw I Branwen Jones a S4C.
Diolch, Prif Weinidog. Mae'r Urdd Gobaith Cymru bellach yn codi arian drwy werthu hetia ar ôl colli oddeutu 165 o'i staff. Ydych chi'n cydnabod bod mudiadau o'i fath yma yng Nghymru angen eich cefnogaeth i ymdopi yn y misoedd nesaf yn sgil effaith y pandemig?
Wel, Branwen, diolch yn fawr. Ni wedi cwrdd fel Llywodraeth gyda'r Urdd nifer o weithiau yn ystod y cyfnod y pandemig, yn wrth cwrs ni'n gwybod mae'r pandemig wedi cael effaith mawr ar y posibiliadau sydd dar yr Urdd i codi arian trwy'r Llangranog ac Bala ac yn y blaen. A ni'n awyddus i gweithio gyda nhw i helpu nhw i codi arian ble maen nhw'n gallu ac i weld os mae pethau ni'n gallu wneud trwy'r yr arian ni wedi roi i cefnogi'r sector. Y gwaith mae'r Urdd yn wneud gyda pobl ifanc yma yng Nghymru yn pwysig dros ben, a ni'n awyddus i cydweithio da nhw i weld os ni'n gallu ffindio ffordd iddyn nhw dod trwy'r pandemig a gallu bwrw ymlaen gyda'r gwaith pwysig maen nhw'n wneud.
Diolch, Prif Weinidog. Ac ar pwnc gwahanol wan, sut mae eich perthynas gyda'r Llywodraeth y Deyrnas Unedig wedi bod dros wythnosau diwetha, ac a di Boris Johnson nôl ar eich rhestr Nadolig eleni?
Wel, diolch yn fawr Branwen am y cwestiwn. Wel, ar un ochr mae pethau wedi wella. Ni wedi cael patrwm nawr dros y pethefnos diwetha, ble ni wedi cwrdd bob wythnos, a mae cyfarfod da ni wythnos nesaf, ac mae pethau yn y dyddiadur am wythnosau ar ôl hynny hefyd. So, os mae hwnna'n digwydd, mae hwnna'n cam amlaen ble ni yn gallu dod dy gilydd mewn ffordd dibiniadwy. Wrth cwrs, dwi'n anghytuno yn llwyr gyda'r Prif Weinidog Boris Johnson pan oedd e'n sôn am datganoli. Mae hwnna ddim yn wir o gwbl beth wedodd e yma yng Nghymru neu yn yr Alban hefyd. So mae'n anodd ambell waith pan ni'n trial i bod yn adeiladol gyda'r Llywodraeth yn y Deyrnas Unedig, pan maen nhw'n mor gas ar datganoli a beth ni'n wedi llwyddo i wneud yma yng Nghymru. Ond dydd i dydd, mae pethau wedi wella dros y pethefnos diwetha. Diolch yn fawr. Over to Rob Taylor at wrexham.com.
Good afternoon, First Minister. In the statement from the incident management team regarding the 15 care home deaths reported this morning, they say, "We'd like to assure all concerned that control measures have been put in place, working jointly with the care home, including limiting the movement of staff and residents to reduce transmission." Will you be ensuring that such measures are in place for care homes across Wales? And why is that the response rather than the standard already?
Well, it is the standard already, Rob, isn't it? It's what we've agreed with the sector, that they must minimise the movement of staff between different locations. that the use of agency staff must be controlled in the same way, and that visiting arrangements at care homes have to be closely aligned with the nature of the population. So I don't think it is a matter of the approach that we have agreed with the sector needing to be amended. It is the delivery of the approach. It is making sure that it is being properly observed in care homes. Care homes, as you know, the vast majority of them in Wales are not run by local authorities. They are run by private individuals, and there are a very large number of different people involved in that. What we have to do is to make sure that the things that we have agreed with the sector are being delivered on the ground, and the IMT, the local incident management team, alongside Denbighshire County Council and the Health Board, have been helping at this care home to make sure that all the things that need to be in place are properly in place.
Thank you. And is it possible to have the latest update on the Wrexham Hospital outbreak? A week ago, the Health Board said there were 20 people affected, and a few days before that, you said it was under control. Is it ongoing, and how many people are currently affected?
Rob, I don't have those figures in front of me, and I didn't see them before I came down here this morning. So apologies. Rather than trying to make a guess at it, they'll be available. We'll get them, and we'll get them to you. Thanks very much. To Thomas Moody at the South Wales Argus.
Good afternoon, First Minister. We've seen rolling weekly case rates in areas of Gwent, such as Blaen y Gwent, Newport and Caerphilly. They've been creeping up again, though not quite at the same rate as before the fire break. Can you share any more detail from maybe the track and trace data that you've seen on why these areas are creeping up when seemingly elsewhere in Wales these are falling?
Yes, well, Thomas, it's a good point you make, and it's a matter of concern to us that we have seen in the last few days the beginning of a creeping up in some parts of Gwent. It's important to get under the bonnet of some of those figures because they can sometimes be driven by very specific things, like an outbreak in a care home of the sort that we've just been referring to, or a workplace. So work is going on at the moment with the local IMT to make sure that we've got a proper understanding as to whether or not those figures are the first signs of an early return of community-wide transmission, or whether they can be explained by the more specific events that you can deal with through the TTP system more easily. The numbers are, they're early numbers, so I don't want to put too much weight on them, but I do want to say that we are concerned and we are taking them very seriously.
Okay, thank you. And on that, are these areas being looked at for the same sort of mass testing that we've seen is going to start in Merthyr Tydfil tomorrow? And have we got has the Welsh Government got the capacity to carry out this sort of mass testing scheme in several areas simultaneously?
Well, not today we don't, but we will learn a great deal from the mass testing in Merthyr. We've been in close touch with Liverpool to learn from their experience, which is interesting, and highlights some of the challenges of a whole town testing regime, as well as some of the very positive things that they've gleaned from it. Our aim is to put this in place in Merthyr on a sort of learning basis. When we've learnt what works and what doesn't work in a Welsh context, then we will hope that we will be able to use that to see whether we would be able to do this again in some other parts of Wales where the need arises. But I think it is important to make sure that we have that learning opportunity before we move ahead and do it elsewhere. Thomas, thank you. Over to Tom Magna at Carers World.
Thank you, First Minister. You've made a lot of announcements over the course of weeks, and there were many issues to discuss. Our viewers are telling me they feel that the state of day centres and day services has been lost in the wash, if I can put it that way. Some appear to have closed permanently, some appear to have closed temporarily, and some have limited availability, we understand. So please can you clarify in as much detail as possible where we are now on this issue of much needed daytime help?
Well, where we are now, Tom, I'm afraid, is that the picture is inevitably complex, because while day centres are able to operate, they will be affected in how they can operate by at least 2 or 3 things, won't they? First of all, they will be affected by the physical space available. And, you know, some of our day centres in Wales are purpose-built and very modern, and some of them are buildings that have been adapted from the Victorian era. Now, you know, when you're talking about social distancing and making sure that things are done properly, not all buildings will be equally amenable to that. So the physical space makes a difference. The nature of the people who would normally go to the day centre will be different. And, you know, some day centres have catered pretty exclusively for people who would be at the most vulnerable end of coronavirus, and therefore, you know, not all of them will be able to resume in the same way, because the risks for the individuals will be different. And then the third variable is staff, because staff are also vulnerable to coronavirus, and some local authorities will have greater numbers of staff self-isolating or, you know, in contact with other people, and that will be making a difference to how far they are able to reopen day centre services as well. So I'm afraid the real answer is that the complexity is unavoidable, and that people are best relying not on a general rule that I could set out for them, but by close contact with the centre they know and the people who are responsible for it.
Thank you for that. Our Welsh viewers are worried that your country could follow the example of Northern Ireland, where we're told that day services and day centres are unlikely to return, full stop. That's the fear there. And our Welsh viewers are expressing that same fear here. And in light of your answer to the first question, it seems that it's actually quite a realistic view on the part of our viewers. Do you agree with that?
Well, I understand it, let me say that. Of course, I understand why people would be anxious about that, but we don't have a blanket approach in the way they've had to in Northern Ireland, where the numbers of cases that they have faced have been far higher than here in Wales, and where, as you know, having just been through a prolonged period of severe restrictions, they're about to re-enter a 2-week fire break period in a week's time. Now, we've been fortunate not to have faced such a severity of public health difficulty as they have in Northern Ireland, and we haven't had to take the same blanket approach. But are people right to be anxious? Well, I can't say that I don't share their anxiety, because as I've said many times this morning, if we don't do the right thing, then the difficulties that they're facing in Northern Ireland could occur here. But that is not inevitable. It's not the case today. And provided people do the right thing, the fact that our fire break has had some success means we wouldn't need to be in a position of blanket inability to resume those really important services. Tom, thank you. To Nathan Shoesmith at the speaker.
Thank you, First Minister. Good afternoon. Turning back to the topic of mass testing in Merthyr Tydfil, what can you say to encourage asymptomatic people to get tested who may be apprehensive to get tested in case they test positive and have to isolate? And to perhaps press you a little bit more on, have you got any idea over timescale for when you'd like to see more mass testing programs in place in Wales?
Okay, Nathan, thank you. Well, on the first point, the real appeal to people in mass testing areas is to come forward because of that sense of collective responsibility. We're not asking people to come forward because there is some immediate benefit to themselves. It is that if you are an asymptomatic person and have coronavirus, then the risk is that without you knowing it at all, you may be giving it to people who matter a great deal to you and whose lives may be at risk as a result. So the appeal to people to come forward is to make sure that you are playing your part in protecting other people. We will have at the testing centres people who will be able to give you advice immediately on the help that is available if you are asked to self-isolate. So we will be able to accelerate the help that people get through the £500 payments and so on. So we will be building into the system help for people who find themselves in that position, and hope that that will encourage people who are anxious for the reason that you said, and which I understand, to do the right thing. And the right thing is to come forward and take a test that is available to you, partly because it will tell you about your own state of health, but mostly because it will make sure that you will then be able to behave in ways that protect other people who matter to you. And in terms of our ability to do more of this, well, that depends a bit on how quickly we get the volume of tests that are likely to be available to us. And we will have thousands of lateral flow tests available every day in Wales. But there's a lot of things that we need to do with those, and we've heard some of them this morning in relation to frontline staff, classroom teachers and students, visitors to care homes, and so on. But when we know the volume, we will be able to plan for whether further whole town tests are necessary in Wales, having learnt first from the Merthyr experience.
Thank you. You've already answered a question today on Boxing Day sales. The Black Friday shopping event takes place this time next week, though many sales are, of course, already underway. Would you be encouraging people to complete such shopping in as few trips as possible, or even to avoid high streets where possible and shop online in order to reduce the risk of spreading COVID-19?
Well, what I say to people is just do it sensibly. You know, don't go mad because of some sort of advertising campaign. Think carefully about the risks that you are running and the risks you the risks that you are taking in relation to other people as well. And if you do it that way, you will think about all the avenues that are available to you. You'll think of the times of day and the places you can go. And provided people approach it in that way, then those risks will be minimised. If people think that dashing out to the shops because of some enticement from the retail sector to do so, then I'm afraid the impact of that will be felt not just in those people's lives, but in what we will all be facing as a result.
Thank you.
Finally, today to Alan Jones of Llanelli Online.
Alan Evans, First Minister.
Alan Evans, I apologise. I've got Alan Jones written down here. I'm confusing you with the Glamorgan opener of the same name.
Right, well, I'm the last batsman, unfortunately. Talking about, thank you, the good news about the hard work of all that the people of Wales have put in and the reduction in the figures. Just a little bit sort of aside of the COVID, but it's still related. One of the major impacts of COVID-19 has been the pressure on local authorities and the cessation of planning meetings. Those who would exploit the situation, including developers, have had almost free rein to begin building on greenfield sites across Wales, opting for retrospective planning as and when things get back to normal at County Hall. Does the First Minister have concerns that local authorities have lost control over planning and developers? And is there not a case for a moratorium now on building on greenfield sites in Wales during the pandemic?
Well, I'm concerned to hear what you say, Alan, of course. I understand all local authorities have had to operate differently during the pandemic. Planning committees are certainly meeting. I know from my own constituency work here in Cardiff that the Cardiff Planning Committee is meeting, albeit online, rather than in person, and that the level of public accountability therefore remains unchanged. And developers certainly don't have carte blanche to build on greenfield sites, and it's a very high risk indeed to assume that you will retrospectively be able to get planning permission if you have built in places which are not in accordance with a local authority local development plan. And indeed, we've recently strengthened the rules here in the Welsh Government so that if a local authority does give permission for building to happen on land that is not in their local development plan for housing purposes, then that decision must come in here to the Welsh Government precisely to avoid building on greenfield sites wherever possible. So, well, you've alerted me to the issue, and I will make sure that our officials have a look at what you've said. But in general, I very much hope that the position you've outlined is not one that is to be seen in all parts of Wales.
And secondly, magistrates' courts across Wales are ending the day with tens of thousands of pounds in a kitty as a result of people breaking restrictions. Is there a case for diverting some of that money to deserving projects dealing with COVID-19, such as food banks and additional support for carers in Wales? And if so, is this a process Welsh Government is involved with looking at present?
Well, I see, of course, the case you make, but the truth is we're not involved in it because magistrates' courts are not the responsibility of the Welsh Government. Any money that is raised at a magistrates' court goes directly to the UK Government, back to the Treasury in London, and we have no say in how it is raised or what is done with it. So, our fixed penalty notices in Wales are not designed to raise revenue. That is not at all why they were introduced. They were introduced in order that our police and our other enforcement agencies have the tools they need to deal with people who deliberately and knowingly break the rules. But when that money is collected at a magistrate's court, it's for the UK Government to decide where it goes and what use is made of it. And it doesn't touch the sides of the Welsh Government in the process, I'm afraid. But diolch yn fawr, thank you very much indeed. Thanks to everybody.